and I have the delightful task of welcoming everyone and introducing our speakers today. Next slide, please. So big thanks to the Reshaping Network for hosting us today. Some folks who are here may be familiar with Reshaping and others may not. So just to give you a brief intro, Reshaping stands for Research on Sexual Health and Adolescent Parenting in Out-of-Home Environments Group. And we're an international network of scholars in social work, public health, public policy, and psychology dedicated to collaborative research on understanding needs and improving outcomes related to sexual health and parenting for youth who are homeless, trafficked, or in out-of-home environments, whether in child welfare, juvenile justice, or other systems. And you can follow us on social media there, or we also have a great website. And huge thanks to our funders, Annie Casey Foundation and Healthy Teen Network for making Reshaping really possible and to happen. Next slide, please. So I'd like to just briefly tell you a little bit about our research team. So funding for the research that you're about to hear about comes from the Annie Casey Foundation. And of course, views are those of the authors and not attributable to the foundation itself. Co-PIs for the project are myself and my wonderful colleague, Svetlana Spiegel, who you'll hear from in just a little bit. We have two amazing youth advisors who are part of our research team, Alexander Sanchez and Sheila Van Wert. You'll be hearing from Mr. Sanchez a little bit later today as well. Want to give a big shout out to our amazing data collector and collaborator, Dr. Genevieve Martinez Garcia from Healthy Teen Network, who is here with us today. We have several data analysts who've been part of the project, Marissa Ventola, Michelle Jasinski, and Amara Channel-Doig. So thank you all for being here today as well. And our wonderful collaborator, Dr. Rhoda Smith from Springfield College. So thank you all for being here with our research team. Next slide, please. So today you'll be hearing from several of us here that I've already mentioned, myself, Dr. Svetlana Spiegel, Mr. Alexander Sanchez, and we also have an expert in digital health communication with us here today, Dr. Devlin Jackson from University of Maryland, Center for Health Literacy and Center for Health Equity. So big thanks to Dr. Jackson for joining us today. Next slide. So to give you a little bit of an introduction to this study, this is a multi-method qualitative study. So it included focus groups and interviews, as well as a photo voice project. We are talking today about a specific subset of that population that we worked with, 23 young parents who are foster care system alumni or who are currently in care, who gave information about vaccination attitudes regarding COVID-19 vaccination. But the larger study is about people's experience within or their experience of the pandemic, who are currently in or have recently aged out of foster care and are currently parenting young children. Next slide, please. You can click through to the content. Thank you. So we conducted focus groups and individual interviews on several different topics: the impact of the pandemic on housing, employment, education, children and parenting, physical and mental health, as well as effects of racism and discrimination during the pandemic, and strengths and supports and services that people experienced as well. So we wanted to have a view of both the challenges and what they found helpful and any barriers as well to those services that have been set up. We also asked questions about vaccination attitudes, which is what we'll be focusing on today in our focus groups and individual interviews. We also same questions regarding vaccination attitudes during our photo voice project. We'll be presenting those results separately, but we had some additional folks who provided data on their vaccination attitudes. Data were all transcribed verbatim and thematically analyzed using a structured thematic analysis approach. And I'm going to turn it over to my wonderful colleague, Dr. Spiegel, who will tell you about the demographics of our sample.
Hi, everybody. Welcome here, and we're very happy to have you. So I'm going to talk a little bit about the sample and the results of our study. And Mara, if you could click through. Awesome. So as you can see, this subset of the study included 23 young people. The majority of them, 19, were young mothers, and we had also 4 young fathers. In terms of race and ethnicity, it's a very diverse sample, and the majority of our youth identified as young people of color. So you could see the racial distribution and ethnic distribution here, and I just want to mention that youth could choose more than one category to represent the racial and ethnic identity. So we've had some African Americans, some Hispanic or Latinx, a couple of Native Americans, and some who identified as multiple race or only non-Latinx white. Mara, if you could have the next slide. Thank you. In terms of ages, so this study included young people ages 18 to 26, and the mean age here was about 22. And all of our young people were either currently in care or aged out of care recently, right? So, so that was the sample that we targeted. All of these young people were in care on their 17th birthday, and some have aged out before and others a little bit later. In terms of kind of, they're all parenting, as my colleague, Dr. Aparicio mentioned, and some of them parented biological children only, some parented non-biological children, and some parented both. So on average, they had, or a range was 1 to 5 biological children and 1 to 2 non-biological children for our participants. In terms of the children's ages, the ages of the biological children ranged from 1 month to about 10, and the age of non-biological children ranged from 1 to 17. So you could see that there was a big variety in terms of the children's ages and number of kids also. And if you could, thank you, Mara. So in terms of living situation, the majority of the youth lived in their own apartment, but you could see that pie chart, some also lived in other living situations, such as share housing with a friend, or a family of the child's father in an independent living program. So we had a pretty wide representation of living arrangements. Most, though, non-surprisingly, lived in their own apartment. And if we could have the next slide. In terms of geographic distribution, so you will see that those gray, the grayed out states are the states that we had youth represented in. So we had quite a bit on the West Coast. We had a little bit in the middle of the country and a little bit on the East Coast. But overall, we had a good representation from various regions around the country. So in terms of kind of what the youth reported, as Dr. Aparicio mentioned, we've asked our young people whether or not they had intention to be vaccinated. And if they did or did not, we also asked them to talk about why or why not. So you could see that at the point of the interviews, which we should mention that the data collection happened from January and until around April. So some of these young people also represent kind of the earlier wave, right, where vaccines were very, very new. But nonetheless, at this point, the majority, about 65% of our young people said that they're not vaccinated and do not have any intention to get vaccinated in the near future. We had about a fifth of our sample who said, we're not vaccinated, but we are considering this. We're thinking potentially to get vaccinated. We're debating whether or not we should do that. And only 13%, which again, out of 23 youth is not a lot, those were the young people that were already vaccinated at the time of the data collection. So, and Mara, if you could click through, in terms of why young people did or did not want to get vaccinated, we got a variety of questions and explanations about the vaccine and their attitudes towards the vaccine. So what are some of the major concerns? A lot of young people, both those that said we have no intention to get vaccinated and those who told us that maybe we're considering, but we're not sure, they were concerned that the vaccines were developed too fast, that there is not enough kind of data, that procedures were hushed because of the pandemic, that everything was rushed through. So they just felt, this is too fast. I am not sure that I am ready to jump on that wagon because this is just being done very, very quickly. And as part of that concern, young people elaborated that they were particularly worried about the short-term and the long-term effects of the vaccination. And they told us that, they're not sure what the effects are going to be. Some of them used words such as, well, I don't want to be the guinea pig in this experiment, right? We're not sure how this is going to pan out, and we are not wanting to participate in this until there is a little bit more data. There was also a subset of young people who had other concerns, and I think it's fair to represent some of the concerns as concerns related to trust, right? So again, this is a sample of young people who have been in the foster care system. And we know from research that some of these young people, they don't trust the system, and by extension, sometimes do not trust other systems also, right? And some of them for very good reason. They've been hurt by the system. They've experienced prejudice and discrimination in the healthcare system also. And they just don't have that level of trust. Some young people talked about that the vaccine were developed under a presidential administration that they considered to be untrustworthy. We had a young person that said, oh, I'm not taking the Trump vaccine. I'm not doing that. But I think the deeper undercurrent there is, I am not sure that I trust the system in general enough to put this in my body. Some young people talked about, does this really work? Is this really going to be effective? We're not sure. Again, this kind of coincided with concerns about this being developed too fast. And they said, I just don't know if it's safe, and I also don't know if it's actually going to be effective. We need more data about this. Clinical trials, great, but this is not enough for us to feel safe with this. And then there were some young people, especially in that group, that said, maybe I want to get vaccinated. They talked about access and availability as potential barriers. Some young people told us, well, even if I want to get it, I might not be able to get it because they don't offer it where I am, or I'm going to have difficulty accessing it, or there's not going to be enough vaccines for me to potentially get vaccinated. And again, some of these concerns represent the months of February and March, where really there was a lot of difficulty to get vaccines and to get appointments scheduled. So we have to keep that in mind. It's possible that some of those concerns would have been less pronounced now, where vaccines appointments are more readily available. But nonetheless, again, these young people sometimes worried about things like transportation and how they could access the vaccine in a way that really is kind of appropriate for them and works with their life. And then the last thing I want to mention here is the youth talked a lot about misinformation, and they worried about the kind of information about the vaccine that they're getting. So they talked about the fact that in the social media and some of their networks, there's so much talk about the vaccines and the potential side effects of the vaccines and whether or not they're safe. And they're just not sure what information they can trust. And again, some of the official sources that a lot of us in the research world and academia, we tend to implicitly trust, those are not necessarily the kinds of sources that these young people go to, right? And these young people implicitly trust. So they talked about a lot of different types of misinformation that they've been subjected to. And all of that really contributed to their reluctance to be vaccinated at this point. On the plus side, many youth said that they were open to changing their minds. So they said, yes, right now I'm not planning to get vaccinated, but if more information becomes available, if some of this misinformation I'm seeing is going to get clarified, if I could trust the sources that are giving me the information, right? If I see my friends and family get vaccinated and they don't have side effects, then potentially I'm going to be open to doing that also. So there is an opening for these young people to be vaccinated. But they just have a lot of concerns. And I think waiting for these concerns to be clarified and for them to feel comfortable. If we can, the next slide. And I'm going to give this to Alexander.
Absolutely. Thank you, Svetlana. All right. So this is next steps call to action. I think the next steps to broadcasting this vaccine would be openly address the concerns without judgment. I know a lot of people from my work who are scared of getting the vaccine because their concerns aren't being addressed. What's going on with the vaccine? They don't hear too much about it. One thing is that one of my friends from work actually got the vaccine, and he had to miss a couple days of work because he wasn't feeling well. He didn't have any of the normal side effects. They were a lot worse. Whole body just out. He couldn't move for, I think it was 2 days he was out. So I think they need to be addressing concerns and being more open about their side effects. Because a lot of people at work were thinking, well, I don't want to get this vaccine because this one guy had really bad symptoms. Another thing that would have helped out my friend is having paid time off to get the vaccine and paid time off for recovery if recovery is needed. I think that would persuade some of our interviewees to get the vaccine as well. Another thing that would help is the mobile vaccination sites. I know we don't have any mobile vaccination sites at our work or anything, or anywhere around where I live, but I think if it was more readily available, especially with the same day appointments, it would, the vaccine rates would astronomically go up. I know it's really hard for some people to find a place to get a vaccine. You could maybe go an hour or two out of your city just to find one, and it could be the same thing for the second vaccine. Some of my family members have had that where they just almost didn't get the vaccine because it was too far. They didn't have time off. They didn't want to go on their day off because they'd be out for the next couple days. They just didn't think it was worth it at the time. But I think that would help out a lot. If we could go to the next slide. Awesome. Community benefits would help out a lot. One thing I think would help out is giving more pamphlets out about the vaccine around the community. I saw some places like Walmart handing out little pamphlets about the vaccine and how it helps. If more people in their community got the vaccine, it would kind of fast track to getting back to where we were before COVID. A lot less people would be getting sick, and hopefully, if enough people got this vaccine, COVID would completely just diminish. I think that's a good way in the community. Leveraging social media and social networks. I think social networks would go along with the pamphlets. Like at work, they don't ever talk about anything about the vaccine. We don't have any on-site places to get the vaccine. And a lot of, in my social network, a lot of people are saying negative things about the vaccine, which kind of runs rampant on my social network. So a lot of people aren't getting the vaccine. One good way of helping with that with social media would be having specific places like maybe pages on social media that you can go to, and there'd be all this information. Hopefully that information would counteract all the misinformation out there on the internet, because there's a lot. Also, this was a big one with our interviewees, addressing misinformation and mistrust. I know I personally don't trust the government. Mainly, I feel like our concerns haven't been addressed properly. And there have been a lot of stuff in my life where I just weren't able to trust the government fully. And a lot of the information on, I guess, social media is where I see it in my social network, isn't being addressed either. So I'm hearing all this, and I'm not hearing anything counteracting anything that I'm hearing. It's just very bad. I'm not hearing anything like super truthful. I feel like the government is more or less kind of hiding it under the rug and just saying get the vaccine without any foolproof, at least in my own personal beliefs. And but one way to counteract all this is the use of trusted health communication sources, whether that be the CDC, or I remember when this first all happened, I went to the doctors and I had to have a conversation with a couple of the doctors and nurses about this COVID-19, because I had no idea what it was. I was super scared. I didn't have any health insurance, so if I did get it, I'd be done. I'd be out. I mean, I'd be in so much debt from the hospital that I wouldn't be able to pay it back. It was very bad, but I talked to some of the doctors and nurses, and they helped relieve some of my stress. And that's it.
Hey, Dr. Jackson. Thanks so much, Mr. Sanchez, for that. Dr. Jackson, we'd love to hear your perspective now.
All right, thank you. So I am really excited to be a part of this discussion. Although my expertise is not in COVID-19 or specifically youth and young adult, what I have learned about this community and what the team has shared with me are some really interesting things as it relates to how this population and this community is responding to the information that's being delivered to our community of young adults and youth. And so the first thing I want to point out is what we know about Gen Z 18 to 26-year-olds and how they are responding to COVID-19 vaccine information. So the first thing is, one thing that they said, and that has been reported in an article recently in 2021, and it was titled, "No One is Speaking Gen Z's Language." And so what that is saying is that the current messages do not speak to their concerns. I want to share a quote from that article by Mr. Nicholas, and it was, "There isn't anything that is consumable and or targeted at our demographic," said Gabrielle at 22 years old, who lives in Washington, D.C., and who has been vaccinated. All the messaging online isn't targeted toward our age group. It doesn't explain why, if you're a healthy 19-year-old, why you should get this vaccine. So that had me thinking, okay, so although we are creating all of these mass messages, and some of them have been tailored to certain communities, we are not doing the best job in creating tailored information to the young adults and youth. You can go to the next bullet. And so we have to think about, well, what are the trusted sources that they're connecting with? What do they respond to? Well, a study by Sanchez in 2020 in JMIR, I believe, they reported that government is still a trusted source for some individuals, for some young adults. And I know that might seem surprising, However, the reason why it seems, it makes some sense, but then it's like, well, wait a minute. This study here on the team just reported that there's some hesitation with the previous administration that the vaccine was created under. Well, what we know is that previously, as even some of our panelists have stated, federal agencies or sources like CDC is still a source that young adults trust and believe in. However, the reason why there's hesitancy is because of other administration that has made them question if the information that is being delivered to them is accurate or not. And the other thing that we've learned, that in addition to them still trusting government to a certain extent, is they also trust the sources of social media influencers and celebrities. So that was reported recently in a study article by Welsh this year. And so I said, oh, okay, this is really good information when we think about recommendations. If you could go to the next bullet. So in addition to sources, we have to think about channels. So what do we know about this community as it relates to the channels in which they like their information delivered to them? Well, social media was overwhelmingly, through my review of the literature, social media was very popular for them. And we've heard that even from our researchers today, right? And so I always tell individuals, when you talk about social media, I need to know which platform are you referring to, because not every platform is the preferred platform for each group. Because we have TikTok, we've got Instagram, we've got Facebook, we've got Twitter. Well, what's popular among our young adult community is TikTok was the most preferred, then Instagram, then Facebook. But what they were reporting was, yeah, TikTok and Instagram and Facebook, it's cool. However, when you all are reporting to us about COVID, and anything is discussed about COVID, you put that little link there. We've all seen that link, right? Where it says, to learn more about COVID information, click here. Well, when we click on it, where does it take us? It takes us to general broad information for the entire US population, not specifically to our young adult community who's going to this platform. And so it had me think, so we know about the sources, we know about the channels, we know what their concerns are, but now what do we do with all of that? You can go to the next slide. So we need to tailor. So what I'm finding in the literature is tailor. Now we've heard this over and over again as public health professionals, as health educators, as health promoters, as community advocates, community engaged workers, practitioners and researchers. We know it. But now let's put on our health communication lens and see what that means when we say tailor. So what that means when we say tailor is, let's first talk about content. So our research team today has given a lot of content in what our young adult population wants to hear about. They want to hear specific content that speaks to, okay, and a report study by the University of Michigan talked about some of these concerns as well. That was recently published. They said they want to know, what are the long-term effects? And it was reported that some of the participants in the study are parents. Well, we already know that there's always been hesitation for a lot of parents when it comes to vaccinations in general. So when you couple that with being a young adult who already has hesitations about, concerns about long-term, like fertility, family planning, right? Or if maybe family planning is not my long-term or short-term issue right now, my other young adult issues might be, well, how does this impact my health insurance? Maybe so yes, I can get the vaccine for free right now, but what if there's a side effect that comes up? What do I do? Do you have something for me and someone like myself? What do I do if I have a bunch of homework or work responsibilities and this vaccine causes me to maybe have some delays for a few days and I still need to pay my bills or other resources? What type of content information do we need to put in there that still says, yes, get vaccinated, but I hear your concerns, I hear your needs. So here's some resources that I can connect you to while we're also trying to ensure that you're safe, right, from COVID-19, and your family member and social network members are safe as well, right? Think about the channel. So let's use this social media, but be specific and strategic with social media. Let's not just simply put in that little link. Click here and go to the CDC. So CDC is a trusted source, right? Which we've heard. Other federal organizations are trusted sources, but let's couple that with our channels. Let's think strategically. So if we're gonna put those links in the channels, let's be more tailored in our content when we're connecting it to a source. Now let's go a step further with our sources and get creative and bring on celebrities. We've all seen this tactic work, right? And we've seen it be effective. We've seen it in HIV/AIDS work. We've seen it in other forms of testing and prevention. Let's now bring in our celebrities that connect with our young adult community. Let's advocate to our policymakers to start considering that type of strategy. We know influencers work. We've seen them get us to purchase certain products. Well, let's see how they can help us engage our young adults with the COVID vaccination, but also addressing their concerns. Let's have some of these influencers talk about their concerns and how they can relate as well. Then the other thing that I encourage us to think about is this including multiple approaches to dissemination of information. So I've talked a lot about social media, but one thing that we need to move towards, in an article that was recently published this week in the New York Times, in BuzzFeed, was talking about how, in this last wave of getting individuals to vaccinate, we need to tailor our information, not just simply to that group only, but to the individuals who influence them. So what do I mean by that? So what we've learned is that some individuals are starting to say, okay, you can only hang out with me or come to grandma's house or come to my house and do play dates if you're also vaccinated and your kids are vaccinated. So what I'm proposing is maybe we create messages to the secondary audience, the audiences that influence the primary audience. Make some messages that say something along the lines like, hey, do you want to be able to see your daughter, your sister, your cousin, your friend more? But they're a little hesitant about vaccinations. Let's communicate with them about your experiences and how it might help them as well. Maybe include other Gen Z or young adult individuals who have seen the benefit of it and how maybe their concerns have been addressed in it. Just a thought. But the point of me saying all that is, we can't just only depend on social media. We've got to go back to our health literacy and health information principles. We're remembering that individuals don't live in a bubble. We all get information from multiple channels and multiple sources. And yes, we know that young adults definitely get it from social media and the government, but they are listening to their friends. They're listening to their family members. They're listening to their coworkers, colleagues. And so let's see how we can strategically engage them in these health communication strategies. And then continue to include strategies to address misinformation. So in those links, figure out ways to address these concerns that maybe are not clear, because oftentimes misinformation comes from information that hasn't been maybe articulated in the clearest way, right? It hasn't really addressed the concerns. So that's how misinformation gets spread. And so we need to address that, continue to think of strategic strategies. And then the last one, consider additional related factors like parental status, having a child versus not having children, wanting to have children in the future, not focusing on that, but that might be a consideration. We know that not just in COVID, as I mentioned before, vaccines are a concern for all parents. So we need to be able to address that for our young adults who are parents or are considering having children in the future. Consider race and ethnicity. It has been widely reported in the general population, the hesitancy that Black and Hispanic community members have. But even more research has reported that our young adult Black and Hispanic individuals and Latinx community members are still having concerns about vaccination. So we need to tailor information to those concerns as well. Acknowledge the distrust, acknowledge the concerns, and figure out ways to address that while also giving them comfort that vaccinations are a good way to go at this time. And then consider SES. We've talked about concerns of healthcare coverage, concerns about employment, being able to take care of certain things if the vaccine causes certain side effects. How do we address these concerns? So I know that these are not necessarily the easiest solutions, and they don't necessarily get to the crux of the overall problem, but I think this is a good start. And I think it's something for us to consider about how do we tailor to this audience? They are speaking loud and clear that we are not tailoring to them. They don't hear themselves in our messages. So how do we create messages to ensure that they are being heard? Thank you.
Wonderful. Thanks so much, Dr. Jackson. That was really helpful. So we're going to open it up now to questions and a discussion among folks who are here today. So I've seen one question that came through in the chat from Barb Toth. Thanks so much for that question. So we had said earlier that 13% of our sample had the intention to get vaccinated. So that includes both people who have had at the time of the interview already been vaccinated and those who were sure that that was the right choice for them. So even if they hadn't yet gotten to a vaccination site, they intended to do so in the very near future. Thanks for that question. Svetlana, did you want to say anything else about that?
Yeah, I just wanted to add one thing, and Dr. Jackson, thank you for your presentation. This was really helpful to hear that broad perspective. I just also want to mention, kind of keeping our specific population in mind, some of the strategies that Dr. Jackson described could be even further tailored to youth who are aging out of care, right? So for instance, there are organizations that are comprised of foster care alumni. They're very active, sometimes in the Hill and Congress and other times on social media and other places. So we could use these organizations. This could be folks that these young people trust, and they might be more willing to hear a message from those sources, right? So in addition to kind of some of the obvious influencers like celebrities and things like that, we could also think about these young people and who are the sources that they trust, right? Who are the people that they really go to when they want to receive information about a sensitive topic, right? So that was one comment that I had. And then the other comment that I had in terms of what Alexander was talking about, and this is not necessarily something that our participants talked about in depth, but something that we know from kind of wider research. There are also some specific barriers that relate to foster youth in particular, right, when they access vaccines. For instance, some states, if a youth is between ages 16 and 18, but under 18 years old, right, and they want to get vaccinated, their foster parents can't just bring them and they would get the vaccine. They have to receive permission from the state child welfare agency to do that. So that could be a barrier in terms of access, but also it could instill further mistrust, right, in the young person. It's like, well, why do I have to go through this extra step? Does that mean it's more dangerous? What does that mean? Another thing that we could think about is even something like photo ID. That is, we all think, okay, well, everybody has photo ID, right? Well, youth in care, sometimes that could be a barrier, right? That could be something that the state child welfare agencies should think about, helping these young people get their photo IDs so they could go and get vaccinated, even if they're after the age of 18, right? And they don't need permission, but some of them have some of those barriers. So just, again, thinking about this specific population, the intersectionality of the various things that we talked about, they're predominantly young people of color, a lot of them struggle financially, right? They have been hurt by the system, some of them, and many of them. So all of these come together to create a lot of hesitance, and we really have to think about them specifically in that respect.
Thank you for saying that. If you don't mind, if I just wanted to respond to that. Thank you for saying that. And thank you for bringing up the point about other trusted sources like individuals within their community, because we've learned, especially when we talk about certain racial ethnic groups, that some sources like religious organizations, community organizations have been trusted sources for them. So if there's a particular organization for the young adult population, especially within the foster system or formerly a part of the foster system, like we should tap into those. So I love that you said that. And then I also would like to point out when we think about tailoring, one thing that I encourage us also to consider is that we not only just simply use individuals that maybe look like the community, but make sure that we're actually using information that they can communicate and speak to these concerns. Because I think sometimes some messages miss that mark. They're like, oh, well, if we put someone in there that looks like them, oh, it'll tap in. But we're seeing in the data, no, we've got to hear, we've got to see the information as well, while we're also looking at someone who relates to my experiences also.
Absolutely. Any questions? Responses? Maybe some reflections on what you see in your community with the young people that you work with?
Go ahead, Dr. Smith. I saw your hand up. Hop on in there.
So I wanted to thank you all for a great webinar. This was a lot of good information, and I know how hard the team has worked to really try to recruit and to get the voices of these young people out there. One of the things that I'm not sure if they're using nationwide, which is one of the issues with the child welfare system, is that there's something called peer family workers, which really they are youth who are in the child welfare system, who have been hired by the child welfare agencies to talk to kids about things like going to counseling, trying to have a better relationship with the worker, trying to communicate better with the worker. So using peer-to-peer kind of voice, I guess, might also help to influence this, which is why I'm really glad that we have folks like Alexandra on the research team, as well as Tammy Fleming and the Annie E. Casey Foundation. This is their motto, is to use young people who can speak for young people and also speak to young people. So I think that that was being related in terms of using social media, because I don't know Instagram from, I can't add another social media thing, but the young people are able to navigate all of those things. So I think that sometimes, as Dr. Jackson had even pointed out in the study, that we are not speaking to them when they are able to access TV and hear us say one thing today and something different tomorrow, or they hear us say that this is what we stand for, but our actions are different. So my last point is to just hopefully get the message out that we don't demonize people who are reluctant to become vaccinated, because especially in the case of these young people, they have a reason to be mistrustful and reluctant.
Thank you so much for pointing that out. Never want anyone to feel demonized about their health decisions. And we talk about that on every level, right? When we think about eating choices, physical activity, preventative choices, whatever that is. So we definitely don't want to demonize. We just want to be mindful that we are being we're giving them all the information that they're requesting.
Thank you for that. Really important points. Really appreciate that. Other questions or comments, things that are striking folks as they're listening?
I think Tammy has her hand up.
Yes, go ahead. Welcome to our wonderful program officer, Tammy Fleming.
Thank you. I'm so sorry I was late. We got caught up in another meeting, and anyway, my question was, I know I forwarded an article to you guys, but and I don't know if that was mentioned, those sort of categories, because everybody who's hesitant isn't hesitant for the same reason. And I'm wondering, and you may have already addressed this, but I do think it's worth the conversation only because I think there's some things that are constant in some populations who have less resources or who are disadvantaged in terms of like this population. But there's some things that is really current because of our political environment that's causing some of the hesitance. And I wondered, like, how do we, because there are different, I think there will be different strategies for answering or for tackling the cause of the hesitancy with these young people. So had you mentioned any of that? Because I know that's some new information that just came out around these different categories of why people are hesitant.
We have not yet talked about that, but I just put the link in the chat so that folks can take a look. And I'm happy to share. Sometimes the New York Times articles are hard to access without a subscription, so I'm happy to share my screen if folks can't access it. But essentially, it breaks folks down who have not yet gotten the vaccination into folks who are actually. Mariah, do you mind just giving me privileges so I can share? Oh, I think I already have. All right, let's see here. I'll switch over so that I can share this with you. Can you all see that? So in the United States, it says this is among folks who've not yet been vaccinated, who are adults. 8% are watchful. They're waiting to see what happens next. And a lot of the youth were in that category. They really wanted to see what happened as more folks got vaccinated in the population. And Alexander, feel free to jump in at any point if any of these you want to comment on them.
Yeah, I'd like to say something. I felt the exact same way. I wanted to wait because there were a lot of stuff on TikTok, like weird conspiracy theories that were saying like the first round of the vaccines given out to everybody is just a trial period and it's not going to go well for everybody. So I was like, well, I guess I'll just I'll wait. And I think a lot of people who saw that TikTok in the comments felt the same way.
Which is really interesting because who's more likely to be on TikTok? Not me. I didn't see it. And if I would have saw it, I probably would have waited too. They probably saying, let's see what happened to those old people before we can
Yeah.
But it is worth us thinking about the strategies because I think not enough of us are really aware of the technology and how messages get out and are received by the younger people.
And I think that one of the things that we could really, this categorization is helpful. And as I'm looking at this, I think we had all of these represented with the exception of COVID skeptics, which I haven't seen as much in my, at least in the interviews and focus groups that I myself participated in. But I think that when we think about strategies, right? So it seems to me that the folks who are watchful, right? They're waiting to see what happens next. Those are probably the people that might get vaccinated eventually, even without a lot of intervention on our part, right? Because they're going to see that their friends are vaccinated, their colleagues are vaccinated, and they don't have very significant side effects, and there is a lot of benefit to socialization and other things. And they're going to say, okay, maybe I'm going to do this too. I think what we really should think about, especially in this particular population, is the cost anxious folks, right? The ones that can't afford the time or the cost, because this is something that the child welfare system and other systems, including employers, could directly intervene in, right? If you are going to give these folks time off to get the vaccine, if you're going to make the vaccination sites close to where those young people live, if you're going to give young people in care time to recover from vaccination, right? If you're going to provide childcare when they take the vaccine, right? There was some vaccination sites say, well, you can't bring anybody else, and there's no childcare provided too. So then young people in this population who might not have supports to watch their children, they're going to say, well, I can't do it then, right? Because I have to bring my kid or I'm not going to come. So that's one group that I think we really can intervene and really make sure that those young people are vaccinated. And then I think the system distrusters, right? That's also a big, I think that was a big chunk of our young people. And again, given the fact that they've been in the system and a lot of them are young people of color, it's understandable why they feel this way, right? So I think that is also a group that we could intervene in. And I think that's a group where the strategies that Dr. Jackson talked about would be particularly helpful, right? Let's deliver the messages to these young people in a way that potentially can increase trust, right? And make them more willing to listen. So I think we should really think about where can we intervene as advocates for these young people, and where could the system intervene and help get the vaccine rates up. So thank you, Dr. Aparicio, for bringing this, because this is, and Dr. Fleming for suggesting it, because this is a really helpful way, I think, to think about, well, what does this mean, right? What can we do with this?
So much for that. Go ahead, Alexander.
I would say my experiences with the DHS system here in Oklahoma has been very bad. I think after that, I started thinking I don't trust the government, because I thought of it as, because I was so young, I didn't know anything about DHS. I thought about it as like a government thing. So I just didn't trust any organization, any government. After I aged out, I moved out, I did my own thing as soon as I turned 18. But I was very, very, very distrustful of any government help or organization at all. So that might have helped with, or that might have contributed to my distrust for this vaccine.
We have some questions in the chat. I think I've seen two. So Mariah was asking how we see public spaces like libraries, community centers, and parks playing a role in helping to vaccinate, because some young people are less plugged in online. And I think that's a very good question. You know, so I was wondering if maybe Dr. Jackson, Dr. Aparicio, if you have reflections on that from public health standpoint too.
So I would definitely encourage that being a channel and a space that is utilized in the strategies, because we have seen, especially those during COVID-19, not having access to internet or broadband or Wi-Fi or what have you. The library has been a great resource. It was a great resource even before COVID-19. And that has been a space that has helped to fill that gap of individuals that are not as plugged in or connected to online spaces. So the libraries, I would definitely encourage. I would still say in those spaces, we need to think about how do we tailor, because a library can be overwhelming, right? So we would need to think critically about how would we work with these library systems to ensure that when a young adult comes in, they are not just given the same general information or pointed to the same general information. And the same for any of these public spaces or any of these community spaces. And I think a great way to approach that is some of the strategies that we've seen used when working with churches, when working with community organizations, and how we have created strategies specifically around a particular topic with particular communities, so that when members of those communities come into those spaces, they are given information specifically for them to, as you said, increase trust, hopefully, and reduce misinformation.
Absolutely. And I would also add that, you know, for these young people who are in care or recently aged out of care, there could be other kind of specific spaces. For instance, you know, some of them connected to independent living programs, right? Can we utilize those programs? Some of them have staff that they trust there, that they've been in contact with for a long time. How could we potentially tap into that and maybe help deliver good information? Dr. Fleming there suggested, you know, there might be connected to preschool for their children, right? And other places that there could be conversations to be had with these young people who might be really more willing to listen, right? Rather than this generic information that Dr. Jackson rightfully said, you know, it just might not work. They don't see that as applied to them. So I think that those are really, really good points, and appreciate your perspective there, Dr. Jackson.
And thank you so much, everybody. We're at time, so I'm going to move us on to the last slide and wrap us up. I'll answer your question briefly, Barb, which is about follow-up. Do we plan to follow up with folks? That would be an amazing additional study that I think we could do. And we don't have plans at present to do that, but I think it's a really great idea and something that we should be considering. So please keep in touch. These are our email addresses. We'd love to hear from you. We will have a research brief. We do have a research brief that is available by request. You can reach out to me if you would like that. We will have a summer webinar from our team hosted by the Annie Casey Foundation. So if you are interested in attending that, please let me or Svetlana know, and we can get you on that distribution list to let you know when that will be. In terms of reshaping, there will be another webinar in future months. Not sure the exact timing if that'll be summer or fall, but we welcome you warmly to join us for that too. And thank you so much for being here. I wish you a wonderful rest of your week. And thanks so much. The recording will be available shortly, and we will share that with you all. Have a great rest of your week. Bye-bye.
Thank you, everybody.